to be here with us. Let me invite Daisy Maninga, social clinical psychologist. Makofi tafadhali. Makofi tena. Makofi tena. Doctor, come and speak to these women. They are mentally ill, they are confirmed. They will prepare.
Thank you so much. At Kitale County Hospital, ile hospitali tulikuwa tunaita district. Si mnajua hiyo district? Pale. So I'm part of the mental health department. I am a senior clinical psychologist. Na najua kwa program hapo imeandikwa psychiatrist. Najua bado kuna social worker. Na najua bado mnachanganyikiwa. Hii zote ni moja ama ni different ama ni nini. But now today I'm here to clarify it all. Sawa sawa. I want to start off with a question. Assuming we'll use this setup, we're all dressed up, sindio? Assuming somebody ran in here naked the way they were born. Hana sindiria, hana ya chini, uchi, na akuja ajifiche nyuma ya hii meza. What are you going to think of them? I just need you to raise your hand and tell me. In my class there are no right or wrong answers. It is about kitu ambacho wewe unafikiria wewe mwenyewe. What will you think of them? Just raise your hand. There's no right or wrong answer. Atasema he or she is mentally sick. Any other answer? Amepatikana kwa nyumba ya wenyewe. Thank God for no children. So hapa leo tunaongea vitu wazi alipatikana kwa nyumba ya wenyewe in a compromising situation, labda na mzee wa wenyewe. Yes. This person needs help. True. Sindio? Thank you. This person is mentally ill. Did we think that labda alikuwa amevaa nice perfumes? I can feel very nice perfumes in ladies. Uzuri wanawake tunanukia kama maua. And I'll be confused this lady or this guy for a flower. Nyuki zikakuja zikamvamia and this person had to remove their clothes. Juu anasema wacha perfume ibaki yuko na akakimbia hapa for safety. Did we think of that? No. I have quite another scenario. My second scenario is, did we stop to think that maybe this person alivamiwa na siafu na akajaribu kuzitoa zikakata and the only option ilikuwa kutoa nguo. Did we think that this person, unfortunately most of these examples apply to women, labda alipita kwa soko, mama wakaona amevaa nguo fupi, wakamwambia unataka kutembea uchi? Tutakusaidia utembee uchi leo. Wakamtolea nguo and she found maybe the best place to get safety ni hapa. Did we stop to think that labda huyu mtu ni mwizi na watu walimvamia and they wanted to ban him, but maybe in that culture wanasema hatutakuchoma na nguo zako, tutakuchoma uchi. Wakamtolea nguo and in the midst of all that alitafuta some safety. That person got to get away. And there are so many other scenarios. Maybe alipatikana kwa nyumba ya mtu in a compromising situation, akarukia dirisha, akatoka nje. So what am I trying to say? I might see a behavior that looks like it's not normal, but until I ask someone, until tukuje tuulize huyu mtu what is happening to you, and they are able to open up, that's the only time we will know what they are going through. Sindio? We know it's not a normal behavior. Ama kuna mtu ameeka in a forum like this akaona mtu uchi. Or did you even stop to think that maybe ni witchcraft? Maybe ni uchawi, sindio? Aka confused day and night, akajikuta mchana. So, we are going to talk about mental health. What is mental health? What is mental illness? How do we get to help people? Mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. Is there somebody who's immune to mental illness? Kuna mtu akona superpower anasema mimi I cannot be affected by mental illness. Is there somebody who can confidently raise their hands here and say that? That you never go through challenges? Is stress good or bad? How many people think stress is bad? Raise your hand. How many people think stress is good? Raise your hand. Little stress is good. Why do you think little stress is good? It makes you think, right? It makes you grow. Imagine a life that had no challenges. Imagine kama hauna challenges kama za kutengeneza work plan, timetables, kukuja class, kunyeshewa asubuhi kwa pikipiki. Would you even think of buying that car? Anyway, so you should be able to cope with stresses of life. So we know everybody goes through stresses. And everybody tries to get solutions to their problems. And I say even suicide is someone trying to get a solution to their problem. It's not a good solution, but they're trying to get a way out of their problems. If we'll get time, I'll be able to talk a little bit more about this. Realize their abilities. Lazima uweze kujua what talent you have. I'm sure everybody has a talent. Inaweza kuwa kuimba, inaweza kuwa you just have a good way to communicate to people. It could be you're good at art. It could be, so you should be able to realize your ability. You should be able to learn well and work well and contribute to the economy. Jipigeni makofi kwanza. Telling you guys to clap for yourself. I don't think I would be here if it was not for a teacher. I would not be here if it was not for a teacher at all levels. And I was trying to teach my younger niece how to hold a pen. Oh my God. Hapo ni shida. So I can't even imagine what kind of challenges you go through trying to make someone learn, trying to see a potential in someone. Unfortunately, not everybody has like 100% potential. Kuna wenye wako nayo kidogo, kuna wenye wako nayo nyingi, but wazazi wanawapatia wote. And they expect, lazima you work on my child. Usiniambie mtoto wangu is not learning as well as others are learning. So a mental illness is characterized by a clinical significance disturbance. So I know this is a lot of technical terms, but just a disturbance in an individual cognition. Cognition means thought. Kila mtu aguze hapa naseme thought. And emotional regulation. Kila mtu aguze hapa aseme emotions. And behavior. Semeni behavior. I know behavior is hard to describe when you're there, yeah? So can anybody know what I'm thinking? No. Can anybody know how I'm feeling? No. But behavior is what is seen. Sindio? We will see this naked person coming here, but we won't know what they're thinking and how they're feeling. Sawa sawa? And sometimes we might not even know we are feeling bad. Actually, we might not be able to know the name of that feeling. We just know, leo mwili imekataa kuamka na kwenda kazi, but I'm just going because I have to go. You just wake up and you drag your body to work. Today my body doesn't want to take care of my children. And what will the society say if I'm a mother and I'm not able to take care of my children? I'm careless. I'm a bad mother. But I'm glad that we've gotten an opportunity to just come out and say, let us take care of ourselves due to better mothers, better sisters, better caregivers. And then society is the burden of ukikuja hospitalini, when you see somebody who's unwell, most times it's a female person who's taking care of that person. You're taking care of your sister-in-law, your daughter, your husband, But when the roles are reversed, poleni for the men in the house. Anyway, I know they're not here. And I'm saying no one is immune to mental illnesses. So maybe you should be able to express to the next person, I'm feeling angry. I'm very angry. And the next person should be able to pick it up and say, I didn't know that's how you feel. That is called emotional intelligence. And if in case, I'm giving an example of maybe if your husband has this workmate, a female workmate, mwenye venye wanatembea you trust your husband, but you don't trust this other woman. See, it happens. See, it happens. Yes. How will what feeling would you be having? You're feeling inaitwaje? You'd be insecure or you'd be jealous. Sindio? But are we able to tell our husbands that we're jealous? Tukimwambia atasema nini? You have a problem. But emotional intelligence means that I should be able to stand and tell my husband, I am sorry, this person makes me feel jealous. I trust you as my husband, but this person makes me feel jealous. And your husband should be able to pick that feeling and tell you, I didn't know that this makes you feel jealous. Our relationship is strictly official, it's strictly professional, and I love you. But tumefika hapo kweli? Have we gotten there? You know, each tabia, is it normal or is it abnormal? So the first D is danger. Is this behavior posing a danger to that person, themselves, or to others? So what do I mean? Danger to themselves. You've seen the mentally ill people barabarani. Na unakwamba wamebeba gunia. Na sisi tunaonanga ni gunia ya uchafu. But be warned, usijaribu kuwanyang'anya hiyo uchafu. To them, it is their gold. Ukijaribu kuwanyang'anya, they will fight with you. So they are danger to others. And sometimes fight or self-harm. The second one is distress. So we have different habits, okay? So kuna wenye wanalala zaidi. How many people can survive with 2 hours of sleep on 3 consecutive days? Okay, how many people? Myself, I try to strive for about 6 hours of sleep. Wangapi wanaweza na 3 hours? How are you feeling by the 3rd day? You're not productive, right? So sometimes there can be a behavior like kuna wenye wanakula zaidi, kuna wenye wanakula kidogo. Na yote ni maumbile ya Mungu. But sometimes I ask, does this behavior bother you? Is it giving you stress? Toto, majukumu kwa mume wako. If you're not able to function properly in all the areas that you're required to, then there's a high likelihood you have a mental illness. The fourth one is deviance. Deviating from what is normal, or we look at culture, we look at religion. Let me give an example. Ukienda northeastern, probably in Turkana. Turkana I think is north. When you go to Turkana, you'll find women walking without, they've only covered their lower part. Is that behavior normal or abnormal? It's normal. Why are we saying it's normal there and me nikifanya hivyo hapa mtasema there's something wrong with me? Because it's their culture. You go to Mombasa, people are in shorter dresses. You go to the beach, people are in bikinis. And we consider that normal. Why? Culture, we're talking about environment, setting. So we cannot separate ourselves from culture and religion. So where do we think mental illness is from? Okay, let's start off with, in our communities, huwa tunasema wanaitwa nani? How do we call mentally ill people? I know they are not the right names, but how do we call them? Let's raise your hand. Huh? Another one? Cheesy, thank you. Ingine? Yes? Mlalu. Okay, that's the first time I'm hearing that one. Mlalu. Shotwaya, thank you. Another one? Another one? Dongo. Sindio? Ama we amepoteza network. But the right term is to just call them mentally ill people. Where do you think mental illness comes from? And I want you to give me all those answers, the myths and the true ones. Witchcraft, ulirogwa. Kuna kitu alitupiwa, si ndio? Na mganga mwenye alimtupia si alikufa. Chronic illnesses, like which? HIV, thank you. Tragedy or traumatic events. Oh, I'm speaking to learned people. Hata sijui kwa nini mimi ndio nakaa hapa nikifunza. All the answers are just here with us. But I just try to categorize them in 3 major areas: biological factors, psychological factors, and social factors. When we look at biological factors, nimesikia kuna walimu wa bio hapa mahali, si ndio? And I'm sure we all have some. I'm speaking to very learned people. So who knows what a tumor is? Yes? It's a growth. It's a growth. Yes? It's a growth. It's uvimbe. Our bodies are made of cells. And there is a normal way that cells should divide. As others die, zinafaa divide. But when they divide too fast at a certain area, tunapata a tumor. If it is a tumor in our brain, we are more likely going to get a mental illness. Hormones. I'm sure we all know about hormones. A long time ago, they used to say women are very emotional people. And there was a theory that there was we have a wandering womb. And that wandering womb is what makes us get very emotional. And that, a long time ago, they used to say women are the only people who are hysterical and men are very sober-minded people. Is it true or not? It's not. Even men have mental illnesses. Sawa sawa. So our hormones are what is responsible for different things. It's what is responsible for reproduction, for our feelings, happy feelings, sad feelings, and sadly enough for women, sometimes in our cycle, it actually affects how we feel. Sometimes when we are cramping, we get very moody and very grumpy. But it's just important for you to be aware of how you're feeling. Genetics. It is true. Have you found families where you have like more than 1 or 2 people with a mental illness? There is a family that used to come, a mother and a son and a daughter. What if they had a mental illness? All of them had schizophrenia. So sometimes it follows, there's a gene that is passed on. Prenatal damage. When you're expectant, whatever you use, whatever you eat, whatever you consume is more likely going to affect your unborn child. It could be from an accident. You get an accident, again I told you our brain is responsible for functions. Substance use. This is very, very common. You know, when I'm speaking to you, I'm speaking to a very important person. Speaking to a caregiver in a home, in a family, sindio? I'm speaking to a teacher in school, and sisi kama wanafunzi, we were very challenging people. And right now, I know even in schools, we're having bang, we're having alcohol, we're having many drugs and yet we don't even know the names of. Okay? Which drugs have you heard of? And even the street names. Ni kama gani? You know how they look like? Yes? Shisha is usually smoked. Bang is one of the most common ones. Do you know how bang is used? It is smoked. Which other way is it used? Inaweza chemshwa kwa chai unywe. Yes?
Unaweza tengenezea kwa chapo, kwa juice.
Unaweza tengenezea kwa chapo, kwa juice. If you didn't know, there's so many ways. Yes?
This kind of drug where our youths are using tampons. They insert alcohol in the tampons and then they insert it from the rear back.
Have you heard that one? She says that you and the amount of people are shaking their head, that's why I'm repeating. They put some alcohol in the tampon and then they insert it. Somehow they get high from it. Bang can be cooked, mandazis, even alcohol. Somebody was giving me a story about a watermelon. You can just cut off a watermelon at the top, and after they take a whole alcohol bottle, inapinduliwa hapo, inaenda yote, and then they'll return that piece at the top, and they'll seal it. And you, over the weekend, it ferments over time. Over the weekend, unaona tu mtoto anakula watermelon. There's nothing harmful with eating a watermelon. But later on, you hear this person, their behavior is really not normal. So I think we also need to keep up with the newer ways that they get palpitations, they're sweating all the time. And most times I'll give you a solution as to what needs to be done. And I know pia naongelesha wazazi wenye wako na watoto. And sometimes you're really stranded, you don't know what to really do. Some of the psychological factors include personality. There are people with a personality, ukikosewa, you keep it in your heart. You hold it in your heart for days and days and days. Na mwenye amekukosea aliuachilia tayari kitambo. There's low self-esteem if every time you just think, mi class yangu kila wakati, it's the last class. I never do well. The principal is always scolding me. I keep on trying, she never sees. And you're having a low self-esteem, even with the way you look. Unfortunately for us ladies, pia Mungu hakutuumba akatupea kila kitu. Kuna vitu alituumba akatunyima, but you just appreciate yourself in the way you are. And you're proud and you dress your body in the way God created you. Being tries to get solutions to their problems. Some of the solutions are not good, like alcohol use, as you say. Cognitive biases, how you're thinking, how you view a situation. Sometimes I try and get a positive thing in everything. Hata kama mvua imenyesha, umenyeshewa, you're on a border, you get a common cold, but you look at something positive, unasema at least mvua imenyeshea mahindi, and the crops are going to grow. And you move on and you're like, tomorrow is another day. So if you're having irrational thoughts and you're thinking, oh, why did it rain? Bona mimi? If you're thinking the world is just always to get you, then you're more likely going to get a mental illness. I talk social causes. We have trauma. I don't know why we didn't talk about this whole thing. We have trauma. Trauma can be emotional, trauma can be physical trauma. Trauma can come from intimate partner violence, trauma can come from a colleague at work, trauma can come from a boss. Boss just tells you, wewe kwenda huko. You never do anything right. Am I speaking to anyone? Or sometimes you can even bully your bosses. And then when they come to discover, am I speaking to anyone? They happen. Every workplace is really different. Children, women, wajane, mayatima. The names in English have just disappeared. So most times they need extra care. If they're not taken care of, they're more likely going to get a mental illness. Sex has gotten to another level. For sexual assault, we have same gender assault, we have different gender assault. Unfortunate enough, we've gotten to a point, even younger children, 11-year-old, 13-year-old. Sasa unauliza what is happening here. And unfortunate enough, there is a recent case that I got of a young girl who got expectant. She's 16, and the boyfriend or the father of the child is 17, and they're in a mixed school. Walimu wa mixed school wako wapi? Wako wapi? Challenges. Nakwambia separating these children wenye damu zinachemka is really hard. So the girl got expectant, she delivered, and the mother was like, we'll take care of the child, but we'll bring you back to school. But akikuja, anapata, the father of the child is just flirting with other girls. Is just flirting, oh, amepewa jumper, amenunuliwa jumper na this other girlfriend. So this girl is trying to focus on her studies. She's trying to raise a child at home. But what grade are we really expecting her to get at the end of the day? It was a really challenging situation. We were discussing as colleagues on how we can assist. What is it that we can really do? I know we are trying to encourage them to go back to school, but is that environment really conducive? And as teachers, you're called upon to be very creative. Sometimes wazazi wanawaangalia wanasema sasa tufanye nini? For me, the advice I was giving is, this girl, her head is already mature. Ameshaanza kufikiria creating a family. Ashaanza kufikiria this is my husband. And where's the husband? The husband is at school. The husband is just an excited boy and is just trying to be a creative and an explorative boy, because they are just adolescents. So sometimes they don't even understand bona tunawakataza. Sometimes we need to come to the level where we explain to them how difficult life can be. And sometimes they are not hawaonangi mbali, wanaonanga tu hapa. Just today, just passing exams. So we need to encourage them even in small steps, just that one step that they can make. For us as teachers and for parents, si tumeona mbali. Tushaona venye wamekuwa daktari huko mbele, but for them they can't see. Sometimes they want to behave like an adult, sometimes they want to behave like a child, and you need to just be with them. It's like a boat that is just rocking in the water. You need to be with them through it all. You need to punish them, you need to show them love, you need to show them all that. Sorry, nimeshaingia kwa adolescence. I told you I'm very passionate about adolescence. So there is death. Death is mostly very difficult, especially for spouses. I'm saying spouses because this is somebody you had built a life with. Mlikuwa mmesema tukikuwa wazee tutanunua sijui shamba wapi, tutajenga nyumba, and then unfortunately this person dies. For the ones who've lost a loved one, they say hata kulala upande wake wa kitanda inakuwa ngumu. Even waking up and trying to go to work becomes really hard because you had built your life around it. Thank God for our traditional settings where matanga people come together. But a year after the loss is where it is really hard to adjust. It is hard to go back to work. It is hard to continue living like life is normal. And continue trying to smile when you're really hurting inside. So death can be a death of a loved one, death of a child, death of a parent. It can even be a death of a child. Umebeba mimba miezi 9 and at the end of it, there's no child. Now you're coming back to work and people are like, congratulations. There's no child. How do you feel about it? How do you even express to people that have lost a child? How do people behave and treat you? I think those are answers that are not, you've had a colleague mwenye amefiwa and you really don't know what to say to them to really encourage them. But there are some words that you should not say. Usiseme, you've lost your grandfather. We alikuwa mzee. Ishi maisha yake. It is really hurtful. Even if you lose a 100-year-old father or grandfather, bado alikuwa wa maana kwa maisha yako. You just tell them sorry for your loss. It must be difficult. Is there anything I can do to assist? Sawa. Difficult, especially for the children. There's one of the clients alikuwa anasema, mimi I want to do DNA test on all the children. Ndio nijue wenye ni wangu na wenye si wangu. And I was asking him, will you be able to tell the children who are not legitimately yours that I'm not your father? And how do you expect them to behave? Those are some of the questions. But for me as a psychologist, I don't get to make the decisions for them. I just help them weigh consequences. Eventually, what you plan to do when you get to this point. So there is substance abuse, family members, if a father is using drugs, if a mother is using drugs, if children are using drugs, it's going to affect the whole family. Romantic failure, the one I was talking about. You love someone loves somebody else, somebody loves somebody else. And I think here my list I should add infidelity. I happen to work at Ampath. And you think infidelity would even be only with the younger people. Someone told me life begins at 40. And you think that infidelity is only with men. Utajua that it is with both genders even right now. True or false? Yeah, we have cultural, social and religious expectations, especially for religious expectations. With things like suicide, they don't want us to talk about suicide. They tell us suicide ni haram, huyu mtu atakufa, ataenda. And somebody is really pressed with a suicidal ideation and they want to talk about it. So we have poverty, unemployment, and even work stress. I think this world has no balance. Uko na kazi, it is stressing you. You're unemployed, it is stressing you. And you don't know where to go, but you have expectations, India. 2 million people in the world are living with mental illness. They're saying it's higher among females than males. I don't know why. Could you guess why? Could you guess why females are having more mental illness than males? Any guess? A lot of responsibilities to hold in the society. That is true. There's someone who said something in relation to maternal. Everybody in the family of your children, do you know you can actually deliver a child and get a mental illness just after delivery? You can get postpartum psychosis, postpartum depression. And men don't have the privilege of getting that. Maybe that's why it's higher among females than males. I want you to count 1 until 4. Just count 1. So among these 4 people, 1 person has a mental illness. Count. 1. Say 2. 4. 1 in every 4 has a mental illness. 1 in every 4. And I'm not exempted from that 4. I'm also part of it. I also go and see a psychologist every other time to deal with my childhood traumas and to deal with any other traumas that will come. To deal with picking up everybody's problems and sitting and thinking, this world is so cruel, or people are so resilient. People don't actually look like their problems. They are very strong. Whatever they've gone through, and this person would have given up. But they seem to be very, very strong, trying to grow themselves And it's a time when wametoka tu from adolescence and they're just very confused about what to do. Like depression and alcohol use disorders are at the top. There are other disorders like bipolar. I'm sure most of you have heard of bipolar. Umesikia kuhusu bipolar? I know I am very well on time, but the next time maybe I will talk a little bit more about what bipolar is. But in short, it just means you have highs and lows. There are times when people are in a manic episode, they are talking very much, they have flight of ideas, they are distractible, they can go without sleeping for even 3 days. Kuna mtu anamwangalia usiku na mchana, and they are very energetic. And then they come from their manic episode and they go back to a depressive episode. In depression, they don't want to eat, maybe they're sleeping all the time, they're very exhausted, they're hopeless, they're helpless, and they go through this cycle. They go through this cycle every other time. All they need is medication and they can function as normal people. These papers, most of the ones you see, ni kama wanasikia sauti, they're seeing things others are not seeing. We have eating disorders, which are very common. Which are the two most common eating disorders that you know? Bulimia, and the other one? Anorexia. Yes? You'll find it affects mostly girls. You want to have a very slim body. So in Amanisha, you don't eat, or when you eat, you just go and gag yourself and throw up everything that you've eaten. So the food is not consumed in your body. It affects mostly adolescents. Then we have other mental disorders. There are so many. So what are some of the warning signs for mental illness? What is it that we will see and we will say, aha, somebody has a mental illness? What will we see? I want at least 3 symptoms before I continue. Yes? Withdrawal, thank you, clap for her. Another one. Another one. Addiction, thank you, clap for her. So you're sleeping less and now you're sleeping, then we know there's a problem. So again, I've categorized according to behavioral, social, and mental. Changes in appetite, changes in sleep, lethargy, which is just basically exhaustion, bowel and bladder movement. I'm sure exams time, mnakuja mnauliza, please teacher me go to the toilet, please teacher me go to the toilet. Karibu kila mtu. It's because they're very anxious, especially about the exams. Libido. Who knows what libido is? We check in Manisha, you guys know, you're just shy to talk about it. So libido is just basically sex drive. Okay? So it is, kama mnajua Maslow's hierarchy of needs, it is, sex is one of the most basic things. Sex is equivalent to food and shelter and sleep. Yeah? If you're not having it, then I don't know. So sometimes there's changes in libido. Sometimes when you're stressed out, you don't even want to see your husband. But because he's there and you don't want any conflict, what do? Nasema amalize? Tulale, sindio? Or sometimes your libido can really be heightened because there is a nice hormone that is released after you have an orgasm. There's a nice hormone that is released. And you really just want that release of the hormone, and then for a minute, your stress is actually done. So changes in libido, if it's higher than normal, there's a problem. If it's lower than normal, then there's a problem. Social changes, neglect of personal hygiene. Kama ulikuwa unaenda nywele, tengeneza kwa salon every other month, and now it's 3 months in and you're not making your hair, and you're not dressing up in clean clothes, there's a high likelihood there's a problem. Sometimes it's just those small subtle changes. Msingoje mtu anze kujiongelesha. But sometimes, again, with these changes, you need to ask them, are you okay? It could just be something, maybe sima ilipotea hiyo siku moja, and they could not and then you're just thinking, aha, this is what daktari said. Inappropriate behavior in social settings, we check what is normal. Somatic changes, fatigue, you're feeling exhausted all the time, weakness, or involuntary movements. Maybe your hands are just moving all the time. This is mostly in severe mental illness. We have restlessness, we have irritability. So zingine, as a teacher, I tell you, children and adolescents can really annoy you. And now imagine you're dealing with 60 of them. 60 of them. And 10 of them annoy you. I remember in high school, we were in class and at the back, nilikuwa nasoma hapa Nikuru tu. At the back, there's somebody who coughed. And then the teacher turned akauliza, nani amekohoa? And nobody could admit it. And before we knew it, all of you mbele ya staff room. Tuka chako sisi wote. The ones who coughed and the ones who didn't cough. But now, as a mental health professional, I understand. Na saa zingine, mwanafunzi ameletwa kwa staff room. And then the other teachers are like, wewe kuja. Unachapa haujui makosa ni gani. And because somebody else annoyed you, and you don't know where to take it out, you beat them. And you beat them so harshly that wengine, it's because you're angry and you're justified to be angry, but your actions are not justified. Irritability means that your anger ukipima na makosa haitoshani. You've heard of this child mwenye ameiba shilingi 5 na anachomwa na mafuta na mamake, and you're looking at it and you're asking, are they in relation? Was there a better way of disciplining? So there is overactivity, withdrawn behavior, which we talked about, changes in speech. There are people who we check, ulikuwa unaongea sana, alafu you started talking less, or you're talking less and now you're speaking more. Is what you're saying making sense? Or you're just repeating certain words? Or you're just talking things that are out of this reality? Thought process, most of the time we will assess thought process through what you say. Disturbance in perception. You're seeing things others are not seeing. See, I'm the only one standing here. Simama kando yangu. If you're seeing somebody else, please come to the hospital and have yourself checked. So, disturbance in perception. You're seeing things others are not seeing. You're hearing things others are not hearing. Especially for hearing, it is very dangerous. Sometimes we see suicide and we think suicide is just related to depression. Sometimes people hear voices telling them, pull a drawer, pick up a knife, stab yourself. Or sometimes they hear voices telling them, stop in the middle of the road, or go and throw yourself in a dam. So sometimes we need to do a further assessment before we just say this person is stressed, alafu naambia tupa, jidunge na kisu. Okay? So, and sometimes you can even feel the smell of things others are not feeling, taste of things, or you can feel something crawling on your skin, and there's actually nothing that is crawling on your skin. Decrease in attention and concentration. Maybe I'm really here talking, lakini akili yako nienda lunch, ama ilishaenda afternoon. Loss of memory, you're not able to remember things, recent memory, things that happened recently, ama kitambo. Disorientation, you don't really know the time, place, and person. Those are the 3 things we assess. Sometimes we ask them, mimi ni nani, huyu mwenye amekuleta ni nani, leo ni lini. Some of our patients say this is 1965 and we are in 2024. So we really know this person is not here with us. So time, place, and person, and where are you? We also check intelligence and judgment. We will tell somebody a question like, if this room was burning up and you were to save a child and money, what would you save? So if you're saying money, we really look at your values and what is that you want. And then your judgment, yeah? Changes in levels of consciousness, if you're awake. So this is just the structure of Kenya's mental health, Kenya's health system. We know at the lowest level we have primary health care. Umesikia wale CHP, community health promoters. These primary hospitals, kama are the sub-county hospitals, kama Kwanza, Saboti, Kachibora, Matunda, Kapsara, all of them have a counselor or a psychologist. And you know, the mode of counseling is that it's not only one session, it is continuous session. So in case you find somebody who needs mental health services, especially counseling, you can refer them to the sub-county hospitals. At the county hospital, we have an entire team of mental health. I work alongside 5 other clinical psychologists, and we have other people in other different fields. Temporary prevention. We need to make sure we're stopping people from developing mental health problems. We need to have a lot of anti-stigma campaigns, teaching school children on emotions and mental health. The manner we are now starting off with teachers before we get to that level. Teaching coping skills, and obviously the positive ones. supporting the high-risk groups, screening of substance use disorders, paying attention to the warning signs which I've talked about, routine medical checkups. Sometimes if you feel like you're not okay, it's okay for you to just come and say, by the way, I'm feeling like I'm not okay, and I don't even know what the problem is. I just feel like I'm not my normal self. And we can be able to just talk about it and find out what is really bugging you. And don't be afraid to ask for help. Sometimes we think mentally ill people ni yule mwenye anaokota makaratasi. But see, I've told you 1 in 4 people. Is there anybody who's picking papers here? When you're stressed, we've seen that everybody goes through stress. When you're stressed, what do you do? Check your body kidogo, you feel good. Yes? You go for a walk, that's good. Oh. We are together, that's right. He's saying that it's normal. Sometimes I like to buy clothes from Petuma. I'd go and get a very nice dress and then I'd wear it. Alafu nijiangalie kwa kioo. This dress really looks nice on me. And then I remove it and I return it. And I'm okay and I move on. Or sometimes you just go and say, if I get money, I'll get this whole unit, this sofa set, this really looks nice. So sometimes window shopping helps. But for somebody else atasema, that doesn't work for me. What else do we do when we are stressed? Comfort foods. Kuku vizuri. I tell myself, if you have stress in life, tumbo yako isikuwe one of your stresses. Shika kwanza, ndio ufikirie. What else do you do for self-care? Yes? You sleep, yes. Some people say, ukilala, ni kama umerudi umereset akili, then you can think. But for some people, they can't sleep. Sindio? Yes? Some people cry, and it's okay to cry. Sometimes we'll go to the toilet and I cry. Lakini ile kulia choo au ni vizuri. To the next door mtu anaweza sikia. Wanasikia. Sometimes crying really helps. And I'm happy that women can get to cry about it. But I'm sad that culture shames men from actually crying. Let's see what we have here for self-care. So they say get regular exercises. At least 30 minutes of walking every day can boost your mood and improve your health. If you can go to the gym, go to the gym. Sometimes I go and run on the treadmill. I try and run faster than my problems. Or sometimes when I'm on the treadmill, I tell myself, at least nimeweza kufanya this exercise that was so difficult. I'm not able to control the outside world, but I'm able to control this small exercise. Eating healthy. So kukula ni mzuri, but you avoid junk. Junk will just give you temporary energy. And stay hydrated. Thank God there's water in every table. Water is very, very important. Reduce your intake of caffeine and alcohol. If you're taking coffee for whatever reason, let's find out, why do people take coffee kwanza? I love coffee. I'm not judging anybody who takes coffee. So just transferring the problem to something else. Because caffeine will get you excited, but later on when the caffeine goes down, unarudi back to factory settings. And avoid alcohol. Have sleep as a priority. I know sleep is really difficult to get, but there are a few tips that you can embrace for helping you with sleep. Kama you know you're always on TikTok, have a regular bedtime and a time for waking up. If you have a bedtime of like 10, if you do it for like over time, like 14 days even, your body will just adapt to it slowly. That ikifika 10, you just start feeling drowsy. And when it's time to wake up, you even beat your alarm. Umeamka even before your alarm is awake. Unaiambia, I know it's morning. So if you have that regular thing, it's important. Itakusaidia, you get enough rest. If you can put your phone, some smartphones that we have can help you go on grayscale. Kienda grayscale, like if your phone is gray mode instead of picture mode and colored mode, at least you'll be able to sleep better. Itakuwa boring and then you just put it away. You can decide to take a warm cup, avoid coffee and caffeine and alcohol before bed. Try and take a warm cup of Milo. Kitambo we used to give younger children that warm Milo, maziwa moto tu na Milo. It works like a charm. But I know some people don't take milk. Sometimes, how many people sleep better when it rains? How many people can't sleep when it rains? Yes, I knew there are others here. Mvua ikinyesha, most times there's a lot of break-ins. Thieves. So there are people mvua ikianza kunyesha, they can't sleep. So if you're the kind of people who can sleep, you can put waterfall sounds or rainfall sounds on your phone, then it will just soothe you to sleep. You can put it for like 15-20 minutes hivi, and then usingizi itakuja. Try a relaxing activity, meditation, muscle relaxation, breathing exercises. Sometimes something as simple as just breathe in, breathe out. Meditation can be, you can walk like in this nice garden and you try and look at things that are similar color. Yellow flower, yellow flower, yellow flower. Red flower, red flower, red flower. Green, it's something stupid, but it takes away your mind because you're anxious, you're thinking of the future. It just brings you back to the present. And then you're able to think and you're able to relax. Set goals and priorities. I know sometimes you have like 20,000 things to do. Women are good at multitasking. But arrange your work and say, this is the most important, this is the least important. Then I will start with the most important. And I know sometimes our bosses, this is the plan I had for the day. Is this a priority? Can I fix this somewhere here? And sometimes you can try and learn to say no. But you can't say no. Just have a discussion. But if it is social things that you can say no to, it's okay for you to say no and say, I can't really take up a lot of these things. Practice gratitude. How many people practice gratitude? Sometimes when we are very stressed out, we think about all the problems that we forget to. And you say, you can have a bad day. But I say a bad day is not equal to a bad life. You can have a day yenye unaamka mpaka ukirudi kulala watu wote wamekusinya, wamekukasirisha. But you need to have this jar where you can just pick one thing that you're grateful for, one positive thing, and read and say, hey, hata kama my day has been bad, I am usually a very talented whatever. I'm a talented teacher of English. One of my students was able to answer questions. Hata kama ulisimama hapo mbele ukauliza and everybody was just on a strike and they're not answering questions, but there was that one chopi. And you're saying, I'm grateful for that one student that enables me to go to work every day. Focus on positivity. Stay connected to family or friends who can provide emotional support and practical help. No man is an island. So some of the professionals in the mental health department is more of a team effort. I can't say I'm a psychologist and I'm working alone. Nitashindwa na hiyo kazi. So we have psychiatrists who are mostly the doctors in the department. And in psychiatry right now we have the consultant psychiatrist and we have the CEO psychiatrist. In Trans Nzoia County we have 4 CEO psychiatrists and 2 consultant psychiatrists who are based at the county hospital. So their work is to write the prescription of medicine. You remember the people I was saying who are hearing voices and seeing things. If they're hearing voices, I can't be able to talk to them until they're stable. So they're written for medications, antipsychotics, antidepressants, sedatives, some things to make them relax. And once the doctor writes the prescription, the mental health nurses are supposed to observe. Some patients will be admitted, observe aone if there are changes. Unfortunately, some of the medication that we give our patients can make them appear like they're doing worse than they were. If you've brought any patient to room 20, saa zingine atadungiwa shindano and then the next day, their head is like this and they're drooling and they look like they're worse than they were before. And I know that works against us because they'll say, "Mmempeleka hospitali na amekuwa vibaya zaidi." So it's important to bring them back to the hospital. There's an injection we give them that will return them back and we can change the medication to something that will work for them. Sometimes it will take us a while before we can get the right medication. But once we do, if the person is on medication throughout, they'll be stable. Then we have psychologists and counselors. What they do is counseling. Counseling can take different formats. Individual counseling, group counseling, couples counseling, and sometimes even family counseling. Family counseling, we get to explain to the family what is happening to this person and what can they do to better manage the person. And then we set goals, but I will not advise my client on what to do. They decide this is what they do. I'll help them weigh the consequences and the pros and the cons before they can take decision. As mothers is tunasema hata wangu walichelewa, hata wangu wewe patie tu time. But the earlier you bring them to the hospital, the better it is for them. They might not be as fast as others, but they'll be able to at least catch up. Medical social workers, there's a case where I had of a woman who was mentally ill. The psychiatrist prescribed the medication. The mental health nurse administered the medications. But there are some oral pills zenye alipewa ende nazo nyumbani. The mother used to come to the hospital with a 4-year-old and a 2-year-old. So yeye alikuwa na meza, anapatia huyu mtoto na anapea huyu. She doesn't know. But you see, me have already done my counseling. Psychiatrist has already prescribed medication, mental health nurse has already administered. But who is going to make sure these children are taken care of? And that is the work of a medical social worker. If it is taking these children, putting them at a safe place, at a children's home, or with relatives who can take care of them until mommy gets better. That would be very important. There's electroconvulsive therapy, but it's a bit more advanced. It's mostly in Madare and Aga Khan. They direct some shockwaves in your brain, especially when medication is not working and counseling is not yet working. A long time ago, those dark years, they used to direct shockwaves to somebody's body, and then they would tremble and somebody would be worse off than they actually are. But right now, at least it's done when somebody is in theater, when somebody is under sedation. And these are also some other advanced methods like vagus nerve stimulation, transcranial magnetic stimulation, creative therapy, art and music, and play therapy. Most children will not express themselves, especially the ones who come from GBV. But you give them paper to draw. They can draw, and from those features we can be able to interpret. Saa zingine, a child will not even have to tell us that daddy is the most influential person in this home and mommy has no voice. You'll just see them drawing daddy with big hands and mommy with no mouth. And from that you can actually know. Or sometimes they will draw a house like this and then they put all the family members there and then they put themselves outside. Then you can tell they feel like they are not part of the family. Or sometimes even play therapy helps us see and embrace and know what is really happening to children. So I think these are some of the things I've mentioned. 18 to 25 years, this is where they're determining their career goals. And family and friends need to be very supportive. They need not to be overly critical. And we're just helping somebody get back to their function. Remember when I said dysfunction, we're helping them get back their function and be able to be to contribute to the society. So suicide refers to the voluntary and intentional act to end one's own life by various means possible. Let me give a question. If somebody, if you had somebody maybe at work, maybe it doesn't happen, but maybe it can happen. Akwekea rat and rat in your food, unfortunately. And then you come and wake up in the hospital. And then for us, we call it OPP poisoning, organophosphate poisoning. Then you find a bad doctor who doesn't actually ask of why you kill. And then wamke and then they tell you, wewe unataka kujinyonga. How would that make you feel? Really bad. Is that suicide? Is that suicide? No. Why? It's not voluntary, somebody else did it for you. Suicide attempt refers to when someone harms themselves with an intention to end their life, but they do not die as a result of their actions. Most times they wake up in the hospital, most times we find them, we grab them from the rope that they're hanging from. And most times with suicide, it's not about people wanting to die, it's about wanting to escape the unbearable pain. Can you imagine if you're feeling very, very low, and you're trying to talk to people about it, and then they tell you, hata mimi. Now that's the problem with peer-to-peer counseling. Hata mimi nilikuanga hivyo, hata mimi appetite yangu ilipotea. So you feel like somebody doesn't really listen to you. Say it's a cry for attention, but are we really giving the right kind of attention? And then unfortunate enough to patikane, and then somebody says, jinyonge, jitupe kwa maji. What will it really do? So suicidal ideation refers to a state of being preoccupied with self-harming thoughts and feelings without necessarily making plans to actualize them. People don't actually say that, nataka kujiua. Do they say that? What do they say? What are the common terms we hear them? I'm tired of life. Nimefika mwisho. Nimechoka. Life is unbearable. Mimi sioni mbele. Mimi ni kama mfu. When you hear those terms, you know that those are terms that somebody is expressing an interest to actually end their own lives. They say that more than 800,000 people around the world die from suicide every year. And this translates to one case every 40 seconds. If we count 1 up to 40, somebody has died from suicide. We're not talking about an ideation, that they have an idea to die. We're not talking about a plan, that they've made a plan. No. This is death from suicide. And they said, for each suicide, there's an estimated 20 attempts. There are people who actually attempt suicide. Kuna like school children utasikia nilikoroga jik nikakunywa. And then what happened? Nililala tu tumbo ikaniuma and the next day I woke up. Unfortunate enough, we don't really even know that they're attempting suicide in schools. True or false? Maybe they've actually made like 20 attempts before this actual one that you found them with. Pesticide ingestion, like rat and rat, deep, hanging and firearms are the most common means. It is the third leading cause of death among youth globally. And we know most of us here dealing with youth and adolescents. They say men complete suicides more than women, but more women attempt suicide. I'll read that statement again. Men complete suicides more than women, but more women attempt suicide. Thinking of the first part of that statement, why do you think men complete suicides? Because they don't share, that's one of the reasons. And because they're so determined to actually die. Sometimes men are so determined with something. And imagine if you actually fail in suicide. You know the way somebody would think, I've failed in life, and now I'm even failing in an attempt to kill myself. Imagine how low that actually feels. But more women attempt suicide. So sometimes women, like, you're very emotional that you don't think through. You just decide, let me just do it. So there's some myths and stigma about suicide. They say that we should not talk about suicide because it's like if we talk about suicide, we are putting ideas into people's heads. You'll tell me what your thoughts are on this. Some people say that only people with mental illness commit suicide, which is actually false. It's not only the people who are hearing voices to kill themselves. Suicidal behaviors are just attention seeking and we should ignore them. Even if it's attention seeking and you ignore them, what do you think will happen to this person? That when someone is considering suicide, there is nothing you can do to change their already made up mind. And only experts can stop suicide. Do you think that is true? Do you think there's something you can do, there's a part you can play to help somebody? It is considered a taboo to talk about suicide or to admit to having suicidal thoughts. Yet open discussion and awareness is needed to support and protect those ones at risk. So some of the risk factors include, if somebody has attempted suicide in the past, they're more likely going to try it again. Harmful use of alcohol and substance use because it impairs judgment. Significant loss, or the trauma impact. You can imagine if your life always rotated around a loved one and you lost them, you feel it's like you want to die, it's like you want to follow them. Sometimes utaona mtu anajitupa kwa kaburi after the coffin has been put inside because they really just want to follow this person. Because life, they can't continue living life without this person. Chronic illness and pain. Chronic illnesses like HIV and AIDS, diabetes, hypertension. Let me tell you, it is not easy. Just if you're not on medication for a chronic illness, try and imagine uandikiwe tu dawa ya malaria. Siku ngapi? 3. An antibiotic. Tunamalizanga antibiotics. Most times we don't even finish antibiotics. Now imagine if your life is hanging on the thread of lazima umeze dawa kila siku. And then you come to the hospital and the doctor tells you, you will die. If you don't take this medication, you will die. Believe me, this doctor has given me an idea. So some people, because it's such a taboo to talk about suicide, because religion shuns it, because culture says that, my culture says that if you die, your body will sleep a sitting room the night before, you'll talk usiku. In some homes with suicide, you'll not even be passed through the door. What a bunja some part of the wall. They'll bring your body here, and then it will be passed through there. Or you will be named. Yani kama jina yako ya familia ilikuwa Malinga, nobody else will be called Malinga. Ndio isifuate laana. What other cultures have we heard of about suicide? Anazikwa usiku, anapigwa viboko, now you're caning a dead body, the person is gone. What else happens? All the bodies are dropped. Are just thrown. You're not given a proper send-off, sindio? Wako unazikwa na wazee, sindio? Or hata hautazikwa the normal time. I'm told the elderly people matanga inaendanga mpaka saa 10. So hiyo unaweza zikwa very early in the morning. Yeah? So you can imagine all these things. Imagine this person who's thinking of suicide. They can't talk and they are caught between a rock and a hard place. And they are having a chronic illness. So it can be very overwhelming to take medication every single day. Untreated mental illness. You can be hearing the voices and then they convince you to kill yourself. Humanitarian crisis and violence. What has happened in Kailuk? There's a disorder called post-traumatic stress disorder. And you ukisikia taya inalipuka hapa unashtuka. You think you're still at that war zone. You still think that those are bullets. You go to sleep, unaona tu mabunduki. You're just hearing those voices. During the day, you're just seeing flashbacks and things happening before your eyes. Availability and access to means of suicide. Most of our policemen actually attempt suicide because they have a gun. And by the time the emotion is coming up, they've already used the gun. Inappropriate media reporting can also cause that. Stigma associated with help-seeking behavior, which is what I've talked about. Lack of social support system. When there's a family history of suicide, they say, children can actually think that it is normal. It is normal to actually die through suicide. And genetic and biological factors. Some of the warning signs. It is very important to know what is it that we are looking out for. Onset of risk-taking behaviors. I have a patient who said, in this road behind, I think from showground up to AIC, no. You know that road is very dangerous, especially at night. One of my female patients says, anavaa hood, anaweka earphones, na anatembea hapo saa 1 usiku. For you, you just think it is just normally walking, but they are putting themselves in harm's way. You get it? For them, they are saying, imagine if you're looking confident, mwizi atakuattack. But you see, you're putting, that is a risky behavior. Sometimes people are driving, they're driving too fast, or they're doing things to put themselves in harm's way. Sudden withdrawal from friends and family, giving away valuable possessions, depression symptoms such as loss of interest, anxiety, they're emotionally overwhelmed, feeling worthless and abandoned. Ama mtu aseme, you ask them, where do you see yourself in a year from now or tomorrow? And then they don't really have a picture of tomorrow. That means this person is really hopeless and they're helpless and they're feeling worthless. They feel like they don't contribute to society or to the economy or to their family. Talking about suicide and planning for death. There's a young boy, unfortunately he died from suicide, and the grandmother was saying he used to take his photo. He had a photo and he asked, hii picha itakaje kwa kaburi yangu? Or someone really saying things like, that hiyo kaburi imekuwa tiled vizuri, or hiyo matanga ilienda vizuri sana. Somebody who admires it. I know there's the normal way of admiring a funeral, like we gave this person a proper send-off. But if it is in a way that looks like it is glorifying death, then that is one of the warning signs. Dramatic changes in mood and behavior, unexplained aggression and irritability. Small thing makes them angry. How do we support? No, I didn't want to show you this slide. We've seen the warning signs, we know the risk factors, and we actually know this person wants to commit suicide. What would you do in your capacity? In your capacity as a teacher, in your capacity as a wife, in your capacity as a mother, in your capacity as a sister, what would you do? Thank you. Show love to this person. Utamwambia jinyonge kabisa. Acha nikuletee kamba zingine nyingi ndio ukufe vizuri. What else would you do? I think we've talked about death and dying for conversations and energy. So this is what you need to do. Reach out with them. Make contact with the concerned person, either physically or virtually. Just give them a call and talk to them and tell them, hi, how are you doing? If someone says fine, you tell them, no, actually, how are you really doing? Okay? So, assess. So maybe they tell you, mimi nasikia ni kama nimefika mwisho. Try and assess. If someone tells you, I've been thinking, nimefika mwisho, you need to ask, what do you mean by umefika mwisho? I'm thinking of actually committing suicide. Have you thought of doing it in any way? Yes, I have. In which way? I have bought rat and rat. Ama nimenunua kamba, niko nayo kwa bag yangu. What do we do? I know we will be scared. Anybody in your situation will actually be scared. But what you do is you make sure you disarm them. Tell them, I understand what you're going through. Show them empathy. Don't demean their feelings. I understand what you're going through is really difficult. And I want us to try and get help. But before we do it, can I keep this for you? Can I keep this room for you? Once they give you that, then you've listened to them. And sometimes there are people who've been thinking of suicide for a long time, but they've not actually done it. Sometimes you can actually ask them, how long have you been having these thoughts? For the last 3 months. And you've not, I applaud you for actually staying alive for these 3 months. What has kept you going? Somebody tells you, my child, or my work, or my friends, and you actually build on that, okay? Then eventually you come and link them up with professional help and a support system. You need food, you need to be warm. That is what psychological first aid actually means. Comforting somebody to help them feel calm, but not pressuring them to talk about it. If they don't really want to talk about it, it's okay. Just make sure they get help. And you protect them from further harm. Launched by the Ministry of Health, just a guide on what to do, especially with suicide cases. And that's the end of my presentation. Is there any question? For unforgiveness, sometimes you need to understand, why am I not forgiving this person? And you need to acknowledge, actually, the pain and the hurt that they actually put you through. And just as in Kenya, it's not just forgiving and forgetting. This person actually harmed you, walikuumiza in your heart, and that's why you choose to actually keep it. You need to acknowledge that this person has hurt you, and you need to choose to forgive them, but you need to understand why you've chosen to forgive them. Okay? The most important thing is to choose to understand why you've chosen to forgive them. Are you forgiving them for you to uachilie your burden? Or are you keeping it, or are you forgiving them because you want them to feel better? You know, sometimes when somebody wrongs you, you want to keep it in your heart because you want them to feel the pain. But do they really feel the pain? So if you're choosing to keep it because you want them to feel pain and they're not really feeling pain, it even adds to your misery. Okay? I've tried to answer that question in the best of my ability. But if there's somebody spiritual, they will help us to answer it better next. How to help a drunkard sibling. As I mentioned, alcohol use gets to a point where it shifts from being a physical problem to now, it shifts from being a behavior to now a physical problem. There are tremors, and sometimes when somebody withdraws from the alcohol, there's the thirst, there's the craving, there's the urge to continue using the drug. And sometimes they are really, they have the will to stop, but biologically they can't because their body is still craving for it. So what happens is, you need to, I think the biggest problem that we do is we send people to rehabilitation centers when they've not yet accepted that there's a problem here and I really need to work on it. So with the help of sometimes a psychologist, you can come and then we have a sit down. And we try and have an intervention with this person and tell them, you see, we really love you. We're not exiling you. We're sending you to a place where you can get help. Look at how much this alcohol use has affected you. The entire family is concerned for you. You're not going to work. You're at the brink of losing your job. your social relations are not well, you're sleeping, unalala kwa mtaro, your health is already affected. And we really need to help you get some help. Sometimes they're like, mimi sikunywi pombe ya mtu, mimi nakunywa pesa yangu. Yeah? I know, we hear those statements in here. But sometimes you can give them a chance and say, okay, can you try and stop it on your own? And when they try and stop it and then you're like, okay, now you've seen, you really need help. So when they go to rehabilitation centers, they're given a medication. It's called naloxone. Then it will help them reduce the cravings. It will help them be weaned off alcohol slowly as they go through counseling and be able to understand that this is something higher than them and they actually need help. How many people think yes, it relieves stress? How many people feel no, it does not relieve stress? How many people are in between? Okay, let me ask the question again. Does talking too much relieve stress? How many people think yes? Yes, please. Oh, so for her it's very conditional. Talking to who? Elaborate. Talking, ni nani ukiongelesha it will not help, na nani ukiongelesha it will help.
Talking can help if you are talking to the right person. But unaweza kuwa unaongea kumbe unajitangaza stress.
True. Unfortunate enough, sometimes you will talk because you want to let it off your chest, and then somebody will pick it and have information to actually go and tell it out. Confidentiality is very important. That is why, even if, not everybody will get an opportunity to come to the hospital. Some people will actually choose to run to you. But by the time unafungua mdomo yako kuambia the next person, what are you expecting? Are you saying it because you want to entertain people, or are you saying because you want to help someone? Think a little critical about it. Think about how that person will feel before you actually open up their stories to others. How do you handle the different generations? That is, according to people born in the 60s, in the 70s, 80s, 90s, and millennials, we all have different ideas. It's a very complex question, but also a very relatable question. For me, I believe in communication. Communication is the biggest thing. Okay? Communication is the biggest thing. Hata kama you're talking to your grandmother, communication is the biggest thing. And communication should just not be, I'm listening to respond, apana. I'm listening and really understanding how you feel. And understanding when hii shida imekukwaza, and sometimes even communication means, when you come to therapy, and maybe there are couples that are quarreling, we do it like baby steps. I'm like, you tell me what the problem is. And then, I will reflect and say what she's saying. And then I confirm from her, has she really reflected what I'm saying? So I reflect the words, I reflect the feelings, without even having to express my mind, first of all, okay? So communication is important, and communication can even be parent to child, can even be boss to peer, boss to a junior staff back to boss, and junior staff back to boss, and peer to peer. As bosses, do we have a point where people can actually just approach us and ask these questions and say, I'm not comfortable with this and this and this? And do we have a forum where juniors can still listen to bosses from where they are coming from? Because I know peer boss are under pressure. So you had Josie, there was a school that had poor performance and they were chasing the principal and the teachers. As if it is the fault of the principal and the teachers, and as if these children are in school 24/7 and they don't belong to a community. So I think the best way to deal with people in different generations is to just have communication. In as much as technologies change and things actually change, having a way to communicate up and down is very important. How much does it cost to have a counseling session? I will respond in regards to the approximate cost in private setting. Approximate cost, hospital, the only charge that you'll have is for counseling per session is just 100 shillings. Utakuja tu ukate receipt for 100 shillings every time you come in for a session. For private settings, I know the rate really varies, but it's approximately 2,000 per session. 2,000 plus 2,000 chill. But don't be shy from coming for sessions because of the cost. You just show up. Sawa sawa. Show up and negotiate. Just say, by the way, Mimi Sina, but I'm thinking of suicide. I would turn you away because you don't really have money. At the cost of, we're also men. So I know there are quite a number of other questions. To be so much in love with sex. So, interesting question. As I told you, we measure libido. Most times if you're having bipolar, you have a heightened libido. Okay? So those are the kind of people that want to have sex more and more. They will even dress in more revealing clothes to actually attract people to have sex with them. But people with schizophrenia actually have a decreased libido. They don't want any intimate connection. The last question I have here, for one to study to become a psychologist, is it a must that you start with medicine? I will explain a little bit of my background in very few words. So for me, I am a clinical psychologist. I did my undergrad in Moi University. I did medical psychology. And then I'm currently pursuing my master's in clinical psychology from the University of Nairobi. But you can do counseling or psychology at different levels. You can even do it at certificate level. There's one more question. You can even do it at certificate level. You can do it at diploma level. KMTC is offering it. Most of the colleges are offering it. Most of the universities are offering it. So you can do it at any one of those levels. But the specialty is what is different. So my specialty is more in hospital setup. Some people's specialties can be in schools. We're hoping in the future the government can embrace having a psychologist actually in school to help the students who have mental illness, to also help the teachers who have mental illness. And maybe even at Huduma Center, we have a psychologist. Ndio usikuja hospitali watu waseme, huyu ameenda mbali sana. So there is less stigma and people can seek medical help. With a repeated pattern of losing sleep at 3 a.m., is it a sign of mental illness? What I usually say, there are thoughts that keep you up in the middle of the night and wake you up. Sometimes those thoughts are what need to be dealt with. One simple thing you can do is get a paper and a pen. Thank God I'm speaking to learned people. Write down those thoughts. There's no specific format. What you're telling these thoughts is, you stay in this book, may sleep, tomorrow I'll deal with you. Sawa sawa. It's a simple thing that you can try. If it works for you, you continue with it. If it doesn't, you can choose not to.